Have you ever heard someone say that a stroke happens suddenly? The truth is, in many cases, our body actually tries to warn us in advance. We just don't notice it. A stroke, also called a cerebrovascular accident, is like a storm happening inside your brain. It occurs when blood flow to part of the brain is blocked, causing brain cells to lose oxygen and get damaged very quickly. But before that storm hits, the brain often sends us silent warning signals. If we can recognize them early, we can prevent serious consequences. The first sign is a sudden and severe headache, a pain that feels completely different from your usual headaches. It can feel like your head is being hit by a hammer, sometimes with dizziness, nausea, or blurry vision. This could mean that blood flow to your brain is being disrupted. Many people tend to just buy painkillers and hope it'll go away. But with this kind of unusual pain, especially when it happens suddenly and without a clear reason, don't ignore it. It could be your golden chance to get emergency treatment in time. Second, blurred or double vision. If you're reading, watching TV, or driving, and suddenly everything becomes fuzzy, flickering, or part of your vision disappears, that's a red flag. It means the part of your brain that controls vision might not be getting enough blood. Even if it only lasts a few minutes, take it seriously. Think of it like a flickering light bulb before it burns out. That's your body saying, "Hey, pay attention to me." Third, dizziness and loss of balance. You may feel like the world is spinning or that you can't stand steadily. This often happens suddenly when the central nervous system isn't getting enough blood. Many people, especially older adults, might think it's just low blood pressure or the heat. But if it comes with nausea, loss of balance, or even falling, treat it as an emergency. Your brain could be struggling to control movement and coordination. The first three signs I just shared might only last for a few minutes and then disappear, making people think, "Oh, it's nothing." But that's one of the most dangerous mistakes. Your body always warns you before something bad happens. It's up to you whether you listen or not. Fourth sign, weakness or numbness in one side of the body, the arm, the leg, or even half the face. You might suddenly drop your spoon or can't lift your arm. That's a classic symptom of a stroke. It happens because blood flow to the brain is blocked, cutting off oxygen to the motor nerves. If one arm suddenly drops when you try to lift both, call for emergency help immediately. Fifth, trouble speaking or understanding speech. When the language center in your brain is affected, you might suddenly start slurring, stuttering, or be unable to understand others. Sometimes people think someone's joking when their face droops or speech sounds funny, but it could be a real stroke. Remember the FAST rule: face drooping, arm weakness, speech difficulty, time to call emergency services. Sixth, sudden confusion or memory loss. If you suddenly forget familiar names, where you are, or what you were doing, that's not just aging. It could mean a lack of blood flow to the memory center in your brain. Many seniors mistake this for normal forgetfulness, but if it happens suddenly and feels different, don't ignore it. Seventh, unexplained fatigue or loss of energy. Even after resting, you still feel weak, sleepy, or down. This could be an early warning sign. When the brain doesn't get enough oxygen, your energy levels drop, and even mild depression can appear. So those are the 7 early warning signs Dr. Z Wellness just shared. Your body is always honest. It always speaks up when something's wrong. Just one of these signs is already a red alert. Don't hesitate, because when it comes to stroke, time is life. Now, what should you do if a stroke actually happens? Every minute matters. Millions of brain cells die every single minute the brain doesn't get blood. So don't panic. Stay calm and act fast. First, call for emergency help immediately. Don't wait to see if it gets better. The first 4.5 hours are the golden window for treatment. Second, place the patient in a safe position, lying slightly on one side, with the head raised a bit to avoid choking. Don't give food or water, and don't try to make them sit up or wake up with home remedies like rubbing oil or scraping. Those can make things worse. Third, remember the exact time symptoms started. that helps doctors decide if treatment can still save brain cells. Fourth, never give medicine on your own. Some people give blood thinners or blood pressure meds, but strokes can be caused by either blockage or bleeding, and the wrong medicine can make things worse. Only doctors can decide what's safe. After surviving a stroke, recovery begins, and this is where the real challenge starts. Many people struggle to walk, speak, or remember things. But the brain is amazing. It can heal itself if we train it. Start physical therapy early. Simple exercises like moving fingers, wrists, or standing with help. Practice speaking, reading, or simple gestures. Every little step helps the brain relearn. Nutrition and sleep are also key. Eat less processed sugar, salt, and unhealthy fat. Add more greens, fish, soy, and fruits. Drink enough water. Avoid alcohol and smoking. And keep a positive mindset. Sometimes that's even more powerful than medicine. Preventing recurrence is just as important. 1 in 4 stroke survivors have another stroke within 5 years if they don't manage their conditions. So follow your doctor's advice, check blood pressure, eat healthy, and exercise regularly. Even small negligence can cause another, worse stroke. Family support is vital. After a stroke, many people feel depressed or scared. Encourage them to join activities, talk, or do small daily tasks. Even simple things like watering plants, cooking, or chatting can rebuild brain connections. A smile, a kind word, a gentle touch. Sometimes those heal better than any medicine. Life is precious. Moments that seem ordinary, a morning walk, a family dinner, a child's laughter, can disappear in an instant. Never take your health for granted. A normal breath, a firm step, a loving hug, they're priceless gifts. Stroke doesn't choose age or status. It can happen to anyone. But the good news is we can prevent it. Take care of yourself. Check your blood pressure, eat well, move often, and sleep early. Don't ignore the small signals your body gives you. If you're watching this today, maybe it's life's way of reminding you. Love yourself because your loved ones need you healthy. A small action today can save a life tomorrow. Share this message with your friends and family so they can recognize and prevent stroke too. Don't wait until your heart stops to realize how precious every beat is. Take care of your health, because life is the greatest gift we can give ourselves and those we love. Thank you for spending time with Dr. Z Wellness today. Wishing you peace, joy, and good health always.